Welcome back to another episode of Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 radio, and there's just so much going on right now in the world of health and wellness, and so many changes. And trying to keep up with all this is really insane. And what's really starting to excite me, and I'll tell you what road we're going to go down today, is the fact that there are people that I've known now for a long period of time, and I've kind of watched their growth, and I'm starting to see the light bulb going on in some people that honestly I really didn't think would be interested in these kinds of topics. I often joke that, when I'm in the doctor's lounge now, and everybody knows that, I'm always talking about all this wellness stuff, these integrative health modalities, biohacking, etc. People are looking down at their shoes, or they're looking to exit, or they're pretending they're going to get coffee or food or something like that because they don't want to get another Sinicropi lecture. But I don't know if the people around me, if it's because I'm just beating them down with just trying to give them knowledge, or at least trying to open the door, or just trying to say, hey, I was just like you. I don't know if it's that, or if it's just something that's going on, with everything that is happening in the, insurance world, what's happening with patients' deductibles, what's happening with the economy. There's so many different things that are affecting the way that people are approaching their own health and wellness. And it's really interesting to see that now some providers are more open-minded to the possibilities that maybe they should be adding a whole host of other things, either, into their, own personal, armamentarium, or whether they should be starting to refer out. In fact, yesterday, I was just randomly, sitting there at my clinic, and, one of our folks came up to me and said, hey, great news. I was talking to these doctors in another part of town, and they've been following you. They've been looking at your website, and they're really interested in connecting with you because they want to know what you're going on, how they can refer patients, how they can get involved. And, I hear things like that, and it re-energizes me because it's really frustrating when you have an awareness that there are certain, things that we can add into our everyday just lifestyles. But then there are all these different, biohacks that are really accessible to almost everyone. There's some cost involved, but there's different ways to get around that and to get about that. But these things truly change lives. And the biggest frustration I've had with this entire integrative health project and doing the podcast and this and that is how closed-minded some people have been. Again, coming from myself, who was the biggest skeptic of all. A lot of people do make fun of me because they know me before I made the switch myself, and how I thought a lot of this stuff was just a bunch of nonsense, and yet I could not have been more wrong. And that that often happens. People see the light. We're trained a certain way, so we get into these silos. I'm going to talk about that in a minute. So what I thought I'd do today on the show is we recently had an event, and I outlined really my own personal transformation, which I've talked about before. I'll touch on it a little bit because, again, I want to lay the foundation. And then I'm going to get into how different integrative health is than what you're traditionally exposed to. Talk about the things I've learned, and then really go through some scenarios of how different it is when you come in with a certain condition, how you're going to be treated in a traditional care system, or one that really doesn't have this kind of open-minded approach, versus an integrative health system provider, some of which are actually within Western medicine, but most of them you're going to find outside of Western medicine. So we'll touch a bit on that on the other side of the break. Again, we're on AM 950 radio. I'm Dr. Sinicropi, and this is Recharging the Human Battery. See you on the other side. and Battery. I'm Dr. Stefano Sinicropi, and we are on AM 950 radio, and I'm excited. I mean, I think this show is kind of almost a summary of a lot of the things we've been talking about. Let's call it like a reintroduction, so to say, on what we're trying to do, because ultimately, everything about this show is keeping you guys healthy and well, and just giving you a sense to what is actually available versus what either your perception of what's actually available, what you're told was actually available, trying to dispel some of these misconceptions that are really holding people back from living their best lives. I mean, there's so much available out there. It's pretty staggering what's available out there to help people, and we've been helping people now on their journeys for a couple years in a totally non-traditional approach, but again, combining it with a completely traditional approach to really try to get the best outcomes for our patients. And so let me tell you about this last week. So this last week, we hosted an event, and it was called The Future of Wellness. And so I opened it up, and my talk was kind of, again, a broad overview, and that's what I'm going to base this show on, because it's really important, so that we have the basics. Because if you're going to join us week in and week out, you have to say, well, why am I joining? Like, what am I trying to accomplish? Right? We're trying to bring you what the future holds. Now, when we say the future of wellness, it's the future for some people. For others of us, it's now. Right, these things are already available now, but we feel like this is going to be kind of the standard in the future. But yeah, people are getting all these kinds of treatments right now. So we had a great showing. We were down in downtown Minneapolis. A lot of people came out. They were super highly engaged, in the event. And obviously, these events, you're going to attract people that are interested, in learning. A lot of the skeptics, you'll get some skeptics out, but most of those are going to say, that's a waste of my time. I don't want to go. But people that are actually interested in learning new things tend to go to these types of conferences because they want to learn more, and we want to keep an open mind. And then they become the ambassadors of some of these things. And again, it has nothing to do with trying, to promote our clinics. We want people to get these treatments wherever they can find them, right? Because a lot of you that listen to me, a lot of people that follow me on social media, they're nowhere near the Twin Cities, but some of this stuff is accessible in other cities and other countries. So we just want to make sure that we get the word out there. But what a great event it was! People were so excited. It was a pretty fired up crowd. It was great, and I could do that for 10 hours in a row. I mean, I'll talk their head off if they let me. But unfortunately, Nancy, who was running the event, kept cutting me off when I was getting fired up. I guess we have to kind of stick with the program. But all right, here we go. So how do we start this off? I mean, I think that the most important thing is that when you're getting your information, okay, and this I really harp on this in my upcoming book called Wellness at the Speed of Light, and that is this. You want to really think very carefully about where you're sourcing your information, and you want to get it from really credible sources. Now, credibility comes from a lot of different things, okay? One are people's, where they trained, their degrees, this and that. I mean, there's a lot of smart people that have a lot of letters after their names, and I don't trust them. I don't trust them because they're siloed. They don't really get it, and so they could be the smartest person in the world if they're not passing on information that's going to be helpful. It's not a help, but overall, obviously, it is a way to gain trust, because at least that says that the person underwent rigorous training, was willing to sacrifice their time and their, sometimes their mental health to get these certain, accolades, or whatever you want to call it, degrees, and then be able to go out into the world and use that hopefully for the greater good. So that's one way, that people, gain kind of authority. Another thing is like kind of when you hear it from your friends and family, hey, this person is the person, to go to. Sometimes it's justified, sometimes it's not. Sometimes it's based on people's, reputations on social media, whether they're TikTok stars, etc. Sometimes it's valid, sometimes it's not, but it does, build to, to reputation. I think another thing is that it's very important, and this is something I just recently posted about this on social media. It's really, this is, to me, this is where I make a decision on whether or not I want to at least listen to somebody, spend my time listening to a particular person's podcast or their social media posts, or even sitting down with them and have conversations. And that's the following. Is that person just talking, okay, or are they walking the walk? I think it's the most important criteria for me personally. It's not for everybody, but it's really, really important. So I think in my case, I think it goes two ways, and this is what I wanted to communicate before I even started talking about, the just getting into the intensity of why I'm so excited about integrative health and what it can do for people, and that's this: the two ways that I think are they're definitely not unique to me, but there's certainly something that definitely, at least I want people to be aware of as they're building their trust, whether in me or anybody else. And that's number one. I'm not coming at this. I've said this multiple times. I've said it on this show. I say it ad nauseum. It's all over the book. I am not in some way some conspiracy theorist. So when I talk about what the ailments are of our current medical system, and I'm so, just kind of disheartened by what I'm seeing, I'm not saying that because I grew up in some family that hated the traditional medical system. No, the family I grew up in, other than a couple of people that were skeptical, everybody else did whatever their doctor said. If their doctor said jump, they would ask how high. So even my upbringing wasn't like questioning what was going on and questioning recommendations that were being made. So again, that's one thing. But as I matured in my career, right, I went to Columbia University Medical School, and then I trained there, and I trained with people that were just brilliant, all right, standing on the shoulders of giants. I mean, amazing, training, but classical Western trained medicine. They had gone through hardcore training, then they put us through hardcore training. This is what we learned. This is the traditional, approach. Then I went out into practice, and eventually, did a lot of work in surgery in the community. Eventually, became the CEO of our company, which I've been running, Midwest Spine and Brain, now for well over a decade. And so you talk about insider of insiders. So if you look at my training, all Western medicine based. If you look at all the people I hung out with, all Western medicine based, hardcore researchers, scientists, clinicians, all of these people, some of them absolutely world-renowned people, right? So I'm around them. Then I go into a practice which is a very traditional, spinal surgery practice, although they were doing some things like outside the box and pain management and a lot of minimally invasive stuff, things like that. But that's cutting edge within that specialty. That is certainly not like some, revolutionary thing. It's great for patients, but it's not expanding it out to their overall health and wellness. But then, as a CEO of a company, I get to sit down with presidents of hospitals, CEOs of major, hospital systems. I get to sit down with administration. I get to sit down with those that are making the decisions that are affecting all of your quality of life. I'm interacting with high ups in insurance companies as we're lobbying both for our company as well as for the hospital systems. I've sat around with health commissioners here in the Twin Cities talking about how important funding is for hospital systems so they can continue taking care of the people that need it the most, and how important that is. That being said, I'm in the room. Okay, this isn't something like I'm outside and looking in, or I'm like reading some like paper, or I'm reading the Wall Street Journal and then coming out with strong statements about the mistakes that we, are making right now. I'm in the room. I'm in that boardroom. I'm around these people. I'm around the patients. I see it day in and day out, and I've been doing it for 20 years. And then what happens? It spills over into eventually just saying, you know what? I see what I see, and I have to say something about it. I'm just not comfortable. But not only am I going to say something about it, I'm going to do something about it. And that's the whole, impetus behind this whole thing. So when I say walking the walk, it's just kind of like I'm in there. But not only that, all of the things that I talk to you guys about, it's almost as if I have been down those paths myself. All the biohacking, all of these longevity strategies, all these other things, I do them myself on a regular basis. So I'm not just here telling you something because I heard it in a lecture that, I signed up for online. I mean, I live this. I see it every day. I live it with my own patients now in the integrative health world and my patients in the spine world that we're getting into doing, all kinds of unique things. So walking the walk is really, really important, right? Getting everyone around me to try to, get into this longevity mindset, this health mindset is so, so important. And I think it's really critical to gain your trust. So I hope that, I've made some inroads in that. And again, trust is hard to earn. Some people get frustrated. They come out, they do 3 social media posts. Oh, nobody's following me. Well, you got to earn their trust first. You could do it one of 2 ways. You could keep educating them and doing stuff, or you can learn some really cool dances on TikTok or Instagram and become famous that way. But are you really earning their trust by doing that? You might. That's one way, but I don't think there's so much education to be done. So, watching us dancing around, it's kind of fun. I don't even mind it if I got forced into doing something like that. But what are you learning? You're learning some other meme dance, right? I'm trying to educate you on what's going on. Anyway, let me not go on a huge, tirade. So how did this all happen, right? So I'm practicing for 20 years. Okay, I'm like 17 years into it. This is 3 years ago before I kind of lost my mind and went down this path, so to speak. But I'm seeing patients in the office, and something is like eating at my soul, and it's the following. You sit down, some of these people I've known way over a decade. What are they? They're sicker. They're more diabetic. They're more obese. Their mental health issues, it's insane. I've seen people go from the highest functioning, most motivated people into these spirals of crazy medications and just mental health issues and all kinds of other stuff. And so much of that could have been avoided. Yes, there's some people, I know what you're thinking. Oh, it's genetic. Oh, they had a predisposition to whatever. Well, maybe it's because they didn't take their diet seriously and they thought that fast food was good every single day. Maybe they didn't stay away from toxins. Maybe they didn't take care of themselves. Maybe they didn't investigate how to manage their stress and do other things and do medication and breathing, all the stuff we talk about here. So anyway, it's heartbreaking to see where people are, and I think the thing that I love to get, and it's true, and I do question people when they come in. People are just more antsy. They're more anxious. They're more like, when I say depressed, I'm not even talking about clinical depression. I'm just like, they're down on the world. And the thing that actually is interesting to me is a lot of people, they're just mad. They're just plain mad. They come in. I've never met them before. I understand they have a problem. And we're 100% here to help you. That's what you're here. You go to the doctor to get help, right? I haven't even spoken a word, and I just asked them this stuff, and they're just angry. And so my first conversation with them is, why are you so angry? Let's get to the root of it. Is it your pain? Is it your thing? Is it what you're going through? Are you just overwhelmed? I think it's so important. But the bottom line is, there is without any question, and I think those of you that are doctors or nurses or any kinds of providers that are listening to me now, ask yourself, really, those of you who have been practiced for 15, 20 years, yes or no? Are people just in general in our society more angry, right? Try driving on I-95 and going the speed limit. You know how many angry people go by me? I mean, I can't, you can't even, because the question is, where are you going? Okay, where are you even going? All right, yes, if you're late, I get it, but not everyone's late on the freeway, right? But they're just all anxious and they're upset, and that's our society right now. There's so much we can do to reverse that. Anyway, I see all this. And after a while, I'm like, I can fix people's spines. I can handle their thing. But if I'm having to sit here watching people getting sicker every single day and just being so disgruntled, eventually I'm like, I got to learn more. I have to just step out of my own comfort zone and learn it, because again, from diet and exercise, I've been counseling patients my entire career, but it's not enough, right? I always talk about, go to the gym 4 times a week. Yeah, good luck getting people to do that, right? Or change your diet by just telling them to change their diet. We have to have like really intense conversations with people and say, well, this is what the changes lead to if you do that. And it's dramatic, and we have to connect, those dots. And we'll get to that here, in a second. So bottom line is, that is the shift. I just call it the shift. I think there's a lot of books out there that are written, they have the words the shift in it. And it's really like when you change your mindset. So, my original title that I wanted to do for my book, and I got a big thumbs down from everybody around. I just wanted to call it The Diary of a Reformed Spine Surgeon, right? But that has like other connotations, like, oh, I was doing something wrong by doing spine surgery or something. Like, no, I love doing spine surgery. I do tons of it now on the right patients. It's absolutely necessary. And without spine surgeons or orthopedic surgeons or general surgeons, it's going to be bad, okay? Because you can't red light away if you have a structural problem. If you have scoliosis, we don't do massage to fix that. You got to fix it. That's a whole other thing. But anyway, I got vetoed on that. But the reason I said reformed spine surgeon, it's not whatever. When I say reformed, my mind has been reformed. Because honestly, I was down the wrong path. And what was that path? It was a path of tunnel vision, of being in silos. And right now, there are so many providers that are in these silos, and they just don't want to look out of it. In fact, when you talk to them about some of these things, they'll just like smirk. They'll just laugh, or inside they'll laugh, or they'll make some comment. I don't mind. I definitely want pushback on these things, because I think very much we don't want to fall in love with any particular thing and say, it's a panacea for everything. However, it's like if somebody comes to me and says, hey, I've been drinking this herbal tea and my life, I literally feel amazing, like my energy levels or whatever. And that's all I did. Like grandma gave it to me and it's changed my life. I'm going to smirk at them. I'm going to, I don't know. I don't even know what tea, but that's what happens. They don't even know what they're talking about, but yet they're willing to do stuff. And that is that siloed mentality. And did I have a little bit of that in me? Yes. Now, I was always generally open-minded. I just didn't want to know anything. I'm like, that's nice, but I don't care, kind of a thing. But once you open your mind and you see the dramatic nature, because I didn't realize that how dramatic these things could impact people, then you're like, oh my God, I care. I couldn't care more. So we really have to get ourselves out of the silos, and the time is right now for people to get out of their silos, because if you keep staying in those silos, I'm just telling you, eventually people are not going to want to see those providers anymore. At some point, there is enough information out there now with AI and social media and whatever that really can tell you. So like, for example, if you go in for depression or you go in for something else and you're getting sicker and you're getting the same old treatments, yes, in the past, they're just like, oh, this doesn't work. Let's change this. Let's change this. Now people just go on AI and say, hey, my doctor did this, this, and that. How's that going? Boom. It'll just spit out and be like, well, there's about all these studies that show that maybe you should go in this direction. So it's really important for everybody to open their minds, because I think as the society opens up, they're really going to want to go to providers that have a very broad, base and understanding of everything that's available out there, can counsel them on everything, regardless of whether their insurance pays for it or not. Because insurance, people don't understand. Even when you have insurance, people end up spending a ridiculous amount of money. And sometimes when you're staying in traditional means, you spend a ton of money, you spend out your deductible, and you get nothing. You get absolutely nothing. Now, yeah, there's a lot of conditions you need traditional stuff. I do a ton of traditional medicine. Okay, but a lot of times we're just spinning our wheels, and we have to do things outside. And a lot of it is holistic. A lot of it it's very, very low risk compared to, medications and stuff like that. So why are we not doing that? So bottom line is, we got to get out of our silos. We can't do it. We just can't do it anymore. And whoever's not doing it, I'm telling you, you're going to fall behind. Maybe not today, but it's coming, and it's going to come quick, because people have pretty much started to have enough of feeling sick all the time, right? So it was interesting, because at this thing, right, I told you about kind of the audience and who was there. I was actually shocked. And so we played a little game. which I like to play, and that's I throw out a bunch of names of things that I think everyone's going to know. So I throw out all these medication names, right, like Lipitor and Prozac and whatever, and I say, who in the room has been, heard about this? Everybody raises their hand, and when I say everybody, I mean like everybody, right? There were like 14-year-olds in the crowd. They know Prozac. They know everything. It's like the McDonald's sign. You know it when you're, 2, right? Everybody knows like these medications because everybody's on them. And then I said things like, dialysis, and diabetes, like some diabetes medications and some other, and these are things with total knee replacement, spinal fusion, all these things. Everybody knows it. Then I started throwing out things like photobiomodulation, which is light therapy, right? And I threw out things like pulsed electromagnetic frequency and peptide treatments and hormonal management, all these things, and MCelliture, all these integrative health things. I was shocked. About half of the people in the crowd were raising their hands. Normally, when I give these types of lectures, there's like literally 2 people out of 100 that have ever heard of any of these things. So it's awesome being in front of an audience who already has a basic understanding of what we're going to talk about, so we're able to go deeper. So that was really just an interesting, eye-opening moment. So I want you guys to become those people, the people that raise their hands. Learn about what's available out there. I'm not saying you have to dive into all of it, but learn about it, so that then you can have it. Because when you know about something, when you know statistics and facts and understand how it's used, then you can make an educated decision on what to do. It's no different than politics, which obviously I never talk about because I help everybody. But it's like politics. It's like going to vote for people or going to vote for somebody that's going to be on a board or whatever. And politics is everywhere. Hospital politics and company politics and country politics, local politics. I've always found it preposterous when people, are out there voting without any knowledge of what they're voting on. They don't understand. That's the same as voting down things that can help you in your life without having an understanding. You're actually, you're gypping yourself, for lack of a better word, just like if you vote for people and you don't understand. Again, that could be at the local level. I mean, you're talking about parent-teacher association board, all these things. When you don't know what you're voting for, you could be making an impact. You could be making a change. And in this, it's for ourselves, for our families, right? For our patients, for the providers out there. Don't vote against yourself, right? Just learn. Please learn this stuff. So then we go down, this rabbit hole of how sick people are. So I'm going to keep this part brief because I do want to get into a couple of different scenarios and what's the difference. And so, 6 to 8 in 10 adults have a chronic disease. This is like ludicrous. If anyone thinks this is normal, I don't know what to tell you. 4 in 10 adults have 2 or more chronic diseases, and more than 29 million Americans have like 3 or 4 or 5 or 6. It's insane what we've got going on. This is not normal. The statistics on obesity and depression and chronic headaches and all these things. I mean, I have a list here that I'm actually looking at it. I'm not even going to read it because it's just alarming. Everything's high. There's nothing that's low. Everything. Anxiety, like Alzheimer's disease, heart disease, stroke. This is what we want? Is this what we want to do? And I had this slide, and it's like, how bad is it? It's really bad. So I pulled up two studies. One's at a University of North Carolina. But anyway, when they look at a bunch of different parameters, each of these studies looked at 5 different parameters of what we call cardiometabolic health. So like things like waist circumference and blood pressure and sugars, things like that. Between 8 and 12% of all of Americans are considered healthy by criteria that are completely reasonable. This isn't like you have to be an Olympic athlete to be healthy. I mean, I'm just talking about like, it's just healthy. Like that is normal. And these studies, one of them goes down, it starts at 18 years old. Think about how many young people are part of it, okay? And one of the studies that found 12.2%, there were 55,000 people that were in the study. It started at age 18. That means a lot of people were in there that were under 40. They should absolutely be, they should be like 80% healthy. Okay, but even with all of those people in the study, it was still only 12% of people, made the grade. That's how bad things are, okay? And when we look at it, how can it be that bad, right? I've said this, I quoted this number, $4.4 trillion on healthcare spend. 90% of it is on sick care because of all those statistics I just threw out there. Of course we're spending trillions of dollars on healthcare. Everyone's sick. It's insane, right? So then only 10% is left to spend on preventative care. What does that put you? It puts you in this crazy like doom loop. Right? You're spending less and less on preventative care, which means more and more people are getting sick, which means you're spending more and more, and then more of those dollars have to go to that, which means you're spending less on prevention, and it's just a vicious cycle. So integrative health is really trying to pull out of that and really get people to that next level to start reversing that and putting more dollars into prevention. Our mentality, it can be completely flipped. It should be 90% spent on preventative and education and stuff like that, and 10% spent on sick care. And I could tell you, if we flipped the script, if we spent most of our money on that and educated our kids from the time they're little, our healthcare expenditures would literally plunge. You guys would feel a million times better. You would have energy. You'd be writing poems. You'd be doing all kinds of stuff. And it's a good time to learn to write poems right now, actually, because we're going to have to fight with the AIs. And so a lot of the mundane stuff they don't need us for. So we still need human creativity. So please learn how to write poetry and things like that. Again, we'll digress. Let me go back. I talked about 4 of my absolute favorite books because I want people to understand there is so much information from incredible authors. One of my favorites, Dr. Lufkin, Lies I Taught in Medical School. Here is a renowned professor at UCLA and UCSC who talks about how he had 4 chronic diseases and he was taking the advice of his doctors and he was getting sicker and sicker despite following everything to the T, taking the medications they were prescribing, everything. Guess what? He went to a completely different approach. He changed his dietary approach, went to more holistic systems, everything we talk about all the time, and reversed his own disease. This guy posts himself like with his shirt off. The guy looks amazing. He's in his 60s. It's crazy. He was on my podcast. Brilliant guy. I urge you to read that book. It will open up your mind. There's another one. I've talked about it before on the show. It's The Hacking of the American Mind. That's Robert Lustig, another Robert, who talks about how much we've been brainwashed by corporatization of the entire society, right? There are food companies out here literally right now in rooms. This isn't a conspiracy theory. This is actual fact, sitting around conspiring on how to addict our children and ourselves so that we are eating, more, peanut butter cups, Reese's, Fruit Loops, all these other things. They make those cereal boxes, those colors to addict us. They have all these food scientists that put all this stuff. This is in my book. It's documented. I've footnoted it up a storm. It's non-debatable. It's the corporatization of everything, right? The corporatization of medicine. Medicine as a whole, and I talk about like the whole entire, corporate structure, they love people being sick. It's great. What an amazing, when you have this amazing palette to choose from, all these sick people, what can we do to them? What medicines can we give them? What next billion-dollar idea of a drug can we just like spread, to everybody? What procedures can we do on all these people? I mean, it's great. It's great for medicine at large, but you know who it's not good for? It's not good for the people, and it's starting to become really not good for the providers in it because they're getting burnt out by taking all these sick people. And guess what? They're the people too. So they're also getting burnt out because they're sick, right? I have a lot of, docs and other providers that are my personal patients. They're not well. They're the same amount of illness as the general population. And maybe from a mental health standpoint, somewhat worse. That's a whole other topic. Eat for Life, Joel Fuhrman, right? He talks about, he's a big nutritarian, which is a more calorie-dense kind of version of veganism. Okay, again, I don't attach myself to any particular lifestyle, but the work he's done to reverse diabetes, improve aging, reverse all kinds of disease is amazing. And then one of my all-time favorites, The Obesity Code, and that is by Dr. Jason Fung, and he talks about, the fact that intermittent fasting can reverse cases of diabetes, type 2 diabetes, in most cases over 80%, well over 80%, and reverse a lot of kidney disease and other things. And I give that book to a lot of my patients, and they've never heard any of these things. No one's ever educated on them. And I could tell you, a book like that could literally change your life. It's not hyperbole. It's not even close to hyperbole. It's just the truth. So then once I, like laid that, we talked about how to get out of the doom loop for people where it's basically like the sicker you get, the less you want to do, the sicker you get, on and on, into the cycle of the virtuous cycle. And that is just by taking this step. So at some point, I need you guys to say the following statement if you're not feeling well. And people have said this, all these motivational speakers say it. I'm sick and tired of being sick and tired. Until you get to that point, for some people, you're not going to open up your minds. Say it again. I'm sick and tired of being sick and tired. If that's you, please make the change. Here's what happens. When you make the change and start small steps, like, for example, you may just change your diet and start feeling better. And, we talk about this ad nauseum. You may start exercising, and that gives you more energy. And guess what? Then you want to eat better because you're starting to look better. You have more energy. You might start down the biohacking route. You might combine, you might be doing some red light therapy, some oxygen therapy, and then you get some laser therapy for your aches and pains. All of a sudden, holy smokes, I feel pretty good. I'm going to just drive to the gym before I go home. I never do that, but I'll do it today. Then that starts that virtuous cycle. And you know what? The better you feel, the more you're going to want to do. The better you feel, the more you're going to want to do. Now you're in the virtuous loop. That is my obsession in life, getting people in that virtuous loop, because we've seen turnarounds that are absolutely stunning, absolutely stunning. So we've talked about dieting on this show and exercise and sleeping and all that stuff. Those are the basics. So I just want to go through we've talked about the two most important ways that when I look at a person in front of me, there are two things. That is this: inflammation is the root of most of chronic diseases and most of what really ails us. And so I want to decrease their inflammation. I want you guys to be thinking that. And then the second thing that is kind of in the background is mitochondrial health. We talked about this a million times. Mitochondria, the powerhouses of the cell, they really determine your energy level. They determine the way that your cells work. They determine the way your immune system can surveil for cancer and take care of, injuries and things like that. And so mitochondrial health is critical, and it is unbelievably vital for heart health, for brain health, where mitochondrial density is insane. There's thousands of mitochondria in those cells, and if those are not functioning at their best, they're not doing so. So that's kind of the basis of kind of how I approach it in my integrative health hat. And it's great when you're targeting inflammation and mitochondria for everything: autoimmune disorders, brain disorders, general sickness, injuries, even musculoskeletal injuries, right? If you decrease the inflammation and you upregulate the mitochondria, you're going to heal a lot faster. And then we talk about the modalities, which we've talked about a lot on this show. So then I really go into, I'm going to talk really briefly about these scenarios. I just want to tell you the scenarios that we did. Generalized fatigue, okay? I'm tired and I don't feel like I used to. It's really one of the number one complaints. If you ask, you're going to get that on half of the people, right? Or more if they want to share it with you. And so integrative health goes deeper. It does a lot more of a functional assessment than you would get in traditional, measures. But again, integrative health is not looking at symptom masking. It's looking at root causes. And so by looking at deeper labs, looking at studies like quantitative EEGs of the brain, looking at other things, we can figure out where's the dysfunction. And then we want to really rev up your mitochondrial function and push down your inflammation. And biohacking is a big part of that. Light therapy, oxygen therapy. There's something called the neurosuit, which is a total body stimulation suit that we use, in our clinics. All of that upregulates the things that you want and brings down inflammation. Perimenopausal symptoms, completely mismanaged in some cases. People are errantly labeled as having depression, all kinds of other stuff. They're putting on meds for their symptoms, root causes. And again, it's very, very important looking at how their hormones are interacting with each other, cortisol levels, estrogen, progesterone, everything. Same thing. We talk about perimenopause. What about andropause in men? There's a time your testosterone plunges. These are very, very important things, and they can be, you can approach those in a natural, natural, holistic way. Sometimes you do need hormonal replacement when you're too far down the path. Again, not medical advice, but things we talked about. We talked about chronic concussion and how different our treatments are, so active and, again, targeting decreasing inflammation, upregulating mitochondria, knee arthritis, stem cell therapies for that, biohacking for that, all this stuff, things you're just not going to get in traditional medical approaches. I'll leave it, with this one, and I'll pick up a couple more on the other side of the break. Urinary incontinence. There is a device that we use in our clinic called the Emcella chair. It replicates tens of thousands of Kegel exercises to strengthen your pelvis. We've turned around people that have had bad urinary incontinence to not having urinary incontinence. We'll see you on the other side of the break. AM 950 radio. This is Recharging the Human Battery. All right, welcome back to Recharging the Human Battery. I'm Dr. Stefano Sinicropi. We're on AM 950 radio, and it has been just a blast for me to talk about this stuff. I wish, like I say many times, I wish the show was 2 hours because I've got so much to say on this topic, which is really front and center for me right now. So I just let me finish up on some of the different ways that you're going to. So, for example, in pain management, something that I'm really excited about, the fact that I have been exposed to so many options outside of what's traditional. So typically, in pain management, we deal with pain medications you guys are all familiar with. In fact, I said the word, I said oxycodone the whole time. The whole crowd raised their hand. Everyone knows about pain medications and things like that. You think about, injection treatments, different types of procedures that can be done for pain, stimulators, etc. Right? There's some hardcore stuff, and some of it works. Some of it works great, and some of it works not. And then there has been a bigger push on kind of the mental health strategy. On how we help our pain, management patients. But to be honest with you, a lot of that's fumbled as well. And I see a lot of these patients that, that are really, pretty unwell from a mental health standpoint, and also have pain. And I just don't see where exactly, there's clearly a disconnect there. And I think that we could do a lot better. But if we look at the way we handle pain management, right, we work with providers that are handling their pain medications and other things. And we do a little bit of that in our integrative health clinic, but mostly we work in conjunction with Western medical providers, but we add other things. Like, so for example, we utilize class 4 laser therapy, which is a powerful analgesic. When you use that laser, really tamps down on nerve dysfunction and can really improve pain. And over time, it stimulates improved mitochondrial function. It heals the area, decreases inflammation, etc. We use green light therapy. And green light therapy, as I've talked before on the show, is amazing because it actually stimulates your body's own natural endorphins. And so you can just imagine, if we're flooding your body with your own natural morphine, then maybe we can decrease your usage of medications. And this is being actively studied right now at University of Arizona in conjunction with the U.S. Army. We do transcranial laser therapy, so we try to stimulate parts of the brain that are really responsible for pain perception. We also do, for people that have anxiety and overlay, like of depression, we do transcranial magnetic stimulation utilizing an exomind device. So it's just this multiple approach. We definitely talk about meditation techniques, relaxation techniques, things like that, the Newcom app, things like that. And we've brought in acupuncture now as another pain management. Acupuncture actually has excellent evidence behind it in the literature, especially in chronic pain patients. Think about the power of combining all those things. Many of you guys have never even been exposed to this and are listening to me right now and are on a ton, of pain, medications. We touched briefly on people that are on GLP-1s, the fat loss drugs, and building back their muscles, and how different the approach is in integrative health, because we're not just trying to get, decrease your weight because we know you lose a lot of muscle, but we have to build back your muscle. And and there's so many strategies to do that. And I could tell you, people are not being offered that. And certainly if you're buying these things online, you're not being offered that. And I'll end with this, and something I'm so excited about. I had my new partner, Dr. Gamze Balchi. She is a triple board certified neuropsychiatrist and also lifestyle medicine specialist. And we talked about our depression treatments and our treatments for cognitive decline, so early Alzheimer's disease, and how an integrative health strategy, which includes things like light therapies, transcranial light, transcranial magnetic stimulation, dietary changes, and all kinds of other things to add to Western medicine approaches, can make a huge difference. And the literature is exploding with the results of these other approaches. So could not be more excited. So glad to have her on board as our director of neuropsychiatry, because we have the intention of really bringing this to the entire world. And I think people are going to be really excited about the programs that we are offering people. So on that, our time is finished. We'll try to touch a little bit on this next week as we dive into a different topic. This is Recharging Your Human Body Radio. Dr. Sinicropi, it's been a pleasure on AM 950 Radio. See you next week.